Thanks for joining us today. We think we have an excellent panel set up. We're going to be talking about, I think, a subject that's important to all of us. With the recent reform that's been passed, there's lots of different opinions about that, but there are a couple things I think that everyone in here can agree with. And that is the pursuit of everything we're trying to do is to create a healthier America that's sustainable. And at the same time, to make certain that we can sustainably improve each American's health. What's paramount then in the discussion and the work ahead for all of us is to think about how we define health. It may seem very simple to you and obvious, but I went back through a process to try to come to kind of a common definition that really brought to perspective the true domain of the way in which I think we need to go about addressing health and what the focus of this panel will be. Back in 1946, the World Health Organization, in its preamble to its constitution, defined health as not merely the absence of disease or infirmity, but rather it's the sustainable presence of physical, emotional, and social health. So you think about that for a second, that's well-being as health defined. And if you're thinking about how do you go about improving one's well-being, there's kind of four areas or domains to think about. One is all the different individual choices that we face every day that lead to the pattern of behaviors that we have. And there's a lot of work there for all of us to be focused on. We also know that having the right access to and the right coordination and the right data and information with experts, whether those experts be doctors, hospitals, laboratories, nurses, kind of the traditional healthcare system set of experts, or whether that be the YMCA, your fitness specialist, your massage therapist, experts who are trained to try to keep you in good health once you've established those behaviors. So the individual has a lot on them. They can't do it sustainably without experts. And then the other two areas of opportunity are around the idea of the environments in which we live. So our real homes, for those of us that work, the work environment, and obviously the communities in which we live. It's kind of a concept of a home radius. 80% of our time as Americans are spent within about a 30-mile radius of our homes. So it shouldn't be any kind of a wonder then that the policies, the cultures, the people, and the way we spend our time within that home radius has a huge impact on our well-being. And then obviously the fourth dimension is who do we select to spend our time with?